There's a lot more going on in your brain than you're aware of. What we think of as our senses, sight, smell, taste, sound, and hearing, is only a small portion of the sensation that our brains are processing at any given moment. There's much more information coming from inside of your body, particularly about your position in space and your movement through space. And that's called proprioception. And proprioception is about 80% of our sensation, and it influences our behavior tremendously. Our brains are constantly trying to understand how we're moving through space and coordinate our muscular action in order to keep us from falling over, but also get us from point A to point B. If you have the idea to reach out for your cup of coffee, there's a lot of stuff that has to go into your body actually doing that. First, your brain needs to know, where is my hand? And where is my mouth? And where is that cup of coffee? What is my position in space relative to that cup of coffee? And all of this stuff is incredibly complex, integrated in the subconscious. You don't even have to think about it, but it's going on all the time. And it is all dependent on your nervous system's ability to sense your position in space. And most of the sensors that tell your brain your position and movement through space are in the fascia. And that is why I spend so much time working on fascia and muscle. There's receptors for movement and position, and these are called mechanoreceptors in connective tissue, in muscle tissue, and in joint, in all of those areas. So when we set out to do body work, if we want to be holistic and we want to help regulate the nervous system, and we want to help a person's body become as adaptable as possible, we need to work on all of those tissues. I feel like a lot of chiropractors miss the boat when all they do is adjust, because all they're doing is focusing on joint receptors. And the point of the exercise of chiropractic and body work is not just to get the bones to line up nice on an x-ray. It's to help a person be more physically flexible, more physically adaptable, stronger, more balanced, because all of that leads to more mental emotional flexibility, more mental emotional adaptability, more mental emotional strength, and a better time moving through the world. Everybody comes to us with certain dysfunctions that are reversible through manual therapy and exercise and breath work, and certain issues that are not reversible. The natural process of aging leading to joint degeneration, or genetic issues that they come with that limits their capability, but we can make them as flexible, adaptable, strong, and balanced and regulated as possible. So this is a video about, why do I spend so much time doing soft tissue work? Why am I spending time demonstrating this on YouTube? What's so important about it? If you don't know me, my name is Dr. David Russ. I'm a chiropractor. I am in Portland, Oregon. I welcome you to my channel. If you like my content, please subscribe. We try to upload videos once a week at least and try and keep it interesting, and I'm glad you're here. So if you've seen any of my treatment videos, you know that I spend most of my time with patients assessing and treating connective tissue, soft tissue, myofascia. I prefer the term myofascia because it encompasses myo, which is muscle, and fascia, which is connective tissue. And the reason that I do it is because that's where most people's issues are, because that's the bulk of our actual physical selves is muscle and fascia, and because it is an intensely sensitive and important and interconnected system. I find the interconnectedness to be not only really mentally fascinating, but also extremely important clinically and really relevant to people's issues. If you think about a tree and the branches of a tree and the trunk of a tree and the roots of a tree, you could walk on the bark from the root where it meets the ground all the way up the trunk, all the way out to any leaf, and from any leaf to any other leaf or any other part of the tree. And it's the same thing in the human body. Inside, you can walk along connective tissue, along fascia and muscle, which are just long strands of protein kind of densely packed together and organized. And they're like roads, and you can walk along them. You could walk from the front of the shoulder, the upper ribs here, along the pectoralis minor muscle to this bone here in the front of the shoulder called the coracoid process, and then down along the biceps muscle to the elbow, and from the biceps where it attaches to the forearm, out the forearm flexors, through the wrist, through the carpal tunnel, all the way out to the fingertips, which is why when someone comes in with a wrist or hand problem, I'm always also going to look at their shoulder and their arm. And if this fascial line is overused and gets tight and tense, that's going to pull that shoulder forward into internal rotation, which is then going to pull the whole shoulder forward, and now through the upper trapezius muscle and the levator scapula muscle is going to create stress on the neck. And then that is connected, of course, to the other side of the neck and down. So if someone comes in with lower neck issue on the right side, and I find some issue over here on the left shoulder, I'm going to work both. And it's that kind of holistic, integrated approach that I find the most fascinating and, more importantly, the most effective for patients. I know a lot of chiropractors will adjust a patient 3 times a week for the first month or so in order to really get the effect that they're looking for. I find that I never ever have to do that. If I'm working with someone more than once a week, it's twice a week, and only for several weeks if it's a real injury and they need consistent care. Most of my patients I see every couple of weeks. If I see them regularly, it's every couple of weeks. And that's because when we're doing myofascial work, we're really much more getting to the root of the problem. There are people who the root of their problem is in the joint, and what they really need is an adjustment or adjustments. And I really enjoy doing that, and I love doing that too. And it's really important. But by far, the great majority of people in this day and age, at least in the patient population that I see, their primary issues are in the myofascia. Tension, trigger points, we'll talk about that in a minute, restriction, and adhesion. Now, where do these come from? Overuse is a huge issue, especially in the upper body. You don't think you're overusing your upper body when you're sitting at a computer, but you are. You're a lot of times leaning forward, which places a lot of strain on the back of the neck. You're constantly doing fine motor skills, typing and mousing with your hands. That can become overuse, and over time, an overused muscle will tighten up and tense up. And since blood has to flow through the muscle, when the muscle tightens up or tenses up, it will literally inhibit its own circulation. Circulation of fresh blood into the muscle, as well as circulation of used up blood out of the muscle and out the lymphatic system. And so what we wind up getting is what you call congestion. And I feel this in tissues all the time. It's something that as myofascial therapists we're always feeling for is areas of congestion. It feels a little boggy, it feels a little smushy, sometimes it actually feels a little cold to the touch, and this is an area where circulation has been inhibited. Circulation is inhibited most often because of overuse. I talked about adhesion. Adhesion happens in places of old injury. So if you sprain your ankle, and it's an inversion sprain, so you tear some of the tissues on the outer ankle, those tissues are going to heal. That's what they do. But when they heal, they don't heal with new, beautiful, original tissue. They heal with a little bit of scarring. And that scarring tissue, we call it sticky. It's not actually like sticky, but what it is sends protein and collagen bridges to nearby tissues to kind of anchor itself, and that now limits the mobility of that joint. If you have limited the mobility of your ankle and you're still walking or running or playing tennis or basketball or skiing or whatever you're doing, that lack of mobility in your ankle has to be compensated for further up the line, in the knee, in the hip, in the sacroiliac, or the lower back. And we see this all the time. People with lower back issues, people with hip issues, and an ankle problem on that same side. And the issue in the hip is coming up because it's been compensating for so long that that compensation has now become its own issue, and is creating other compensations on up the line. So it's important to address the symptom, which is the hip pain or the lower back pain, but it's also important to address the cause, which in many cases is lower down the chain in the ankle, because we can adjust that sacroiliac joint daily if that's what we want to do, but we don't want to do that. If we adjust the sacroiliac joint and relieve the pressure and the patient feels better, and then on the way to their car, because they're walking and their SI joint is compensating for a restricted ankle, they're going to walk that SI joint right back out of line, and I haven't done them any good. They're going to have to come back the next day or 2 days or whatever to get it adjusted again and again and again and again. And over time, that can be detrimental because we're going to overstretch that SI joint ligament and create some instability. Why don't we take some time to assess the whole lower quadrant of the body and see if we can identify other, perhaps more fundamental or older mechanical issues, in this case, as we're talking about an old inversion sprain that has created adhesion in the outside tissues of the ankle, which has created some restriction of mobility of the ankle, which creates compensation in the lower back and lower back pain. Let's look at that ankle and see, can we use myofascial therapy to restore mobility to the ankle, which will then take pressure off the SI joint, and then you don't have to keep adjusting the SI joint. The SI joint will take care of itself. It wants to be aligned. And if it can be, it will be. It might need some help. It might need an adjustment or 2 or maybe 3. But if you've taken care of the root cause, it's going to go in and it's going to stay in. So another reason why I love to do myofascial work is because of the sensory experience that it gives the patient. And to get people's nervous systems on a conscious and subconscious proprioceptive level, to get their nervous system connected to the dysfunction is healing, and it's really important. You know, they always say the first step to solving a problem is admitting you have one. The same is true of biomechanical issues in the body. Your body cannot correct your ankle or fix your posture if it doesn't know that there's anything wrong. So a big part of what we do with our hands is bring sensation to the brain of the issue. And sometimes that is interpreted by the brain as pain. It's like that good hurt. That's what that good hurt is. Like, oh, I didn't know that was there. That feels weird. It's kind of painful, but kind of good. Some of the great feedback I love getting from patients when I'm working on them is, yes, that hurts, but it feels necessary. That's usually I'm like, okay, we are in the right place. This is an area of the body that the brain has disconnected from. And it's really important to provide the patient with that sensation and to do so in a way that feels safe for them so they can relax into it and integrate that, and they're not guarded and kind of resisting the sensation because as a practitioner, maybe you've gone in too deep too fast. So it's super important to work gently and slowly but directly so that when you find the spot, you don't just start wailing on it. You take your time, work through the layers from the skin, through the adipose tissue, through the superficial fascia, the deep fascia, into the muscle, to whatever level that the dysfunction and the issue is. You want to take your time getting there so that the patient's brain can integrate what it's feeling and not resist. So if a patient is resisting your work, it's not going to work and you're probably going to wind up hurting yourself. So if you are a provider and you're watching this video, just a little tip for you that I've learned over the years. We have a lot of patients who are really thick and really dense, and they have a lot of muscle tissue. And our instinct often is to increase the pressure that we're using to try to get deeper, but that's actually not effective. When you have someone that has thick, dense connective tissue, you want to slow down. You want to soften up. You need to work your way through these layers one at a time. We think we know the issue is in the deeper tissue and we got to get right in there, but no, take your time. Trust me, the patient senses their skin. They sense their fascia. There's so much sensitivity and sensory activity coming from that superficial fascia. Working through that, getting blood flow through there, getting lymphatic flow restored through there is going to affect the deeper tissues tremendously. It's also going to help them relax so that you can get into the deeper tissue over time. And it's also going to save you a lot of energy and save a lot of wear and tear on your hands. So these are just a couple of the reasons why I think myofascial work is so important. That sensory experience from the patient's point of view, it's much more holistic, it's much more effective at resolving the kind of problems that people come in with. And also it's just what people need. So this has been a shorter video. I hope that you have enjoyed it. I thank you for watching, and I always appreciate and welcome your questions and comments. Dr. Russ signing off.